Hello everyone, welcome to Challenges. Nowadays we know that many parents are under stress because their children have difficulty in the physical skills, sensory skills or cognitive skills. Occupational therapists are some among the healthcare professionals who is playing a key role in putting these kids back to the normal life or supporting them to do their daily living activities. So in this video, let's have a discussion with an expert, an occupational therapist, to know more about it and something that a parent should know when to approach a occupational therapist and what are the things we should avoid for our kids to get acquired issues related to the physical or sensory or cognitive skills. So stay tuned with me, and if you are not subscribed to my channel, please do subscribe to watch more videos on health and information related. Hello everyone, so with me Mr. Satish, who is the Clinical Director of Qatar Institute of Speech and Hearing. Thank you so much Mr. Satish to be with me in this video.
Thank you very much Salina for having me in your show.
So let's get into the questions
Yes.
now. What is the vital role of an occupational therapist?
Occupational therapists, they usually focus on the person's activities of daily living, and when the person is injured or when the person is disabled and there will be a limitation in doing their activities of daily living, means eating, dressing and toileting, everything. There will be a limitation, and those people will be dependent to some other relatives or whoever it is, the caretaker. But occupational therapy, when they come to occupational therapy, the occupational therapists focus on their activities of daily living, how the person can do those activities independently without any support, by providing some modification in their houses or providing some adaptive equipments like that.
Okay, so you are more towards the sensory and fine motor skills.
Exactly.
Okay.
Yeah.
So nowadays many parents are under stress due to their difficulty of their kids in their motor skills or sensory skills or cognitive skills. How you can advise to a parent to identify or understand that the child is in need of an occupational therapist support?
Good. Actually, early identification is always better to avoid future complications. So we would advise parents to observe their child when there are two main warning signs of the child that is a prediction that the child is going to have some kind of difficulties in the later stage. One is their low muscle tone. That means the muscles are kind of floppy. There is no proper strength to uphold the body. And second one is delayed developmental milestones. That delayed developmental milestones means it's not only meant for this gross and fine motor skills, but it is also included with the speech, cognition and social, all aspects. So if there is any delay in any one of the domain, then it is a clear indication that something is not functioning well within the brain. So we need to seek a professional help immediately.
Okay, so can you make it more specific for a normal, ordinary mother who is not from a medical profession? What are the skills she have to look at?
The mother can, when the mother can lift the child, she can feel that the child is heavy or it is like a floppy or something like very lightweighted. Then that is a clear sign. Even if you have the baby on your hands, he has to lift his neck to some extent, or he has to extend the body to some extent. But if the child is not able to do that and it is like always collapsed state, then it is a clear indication that the muscles are not developed properly.
In a flexed state.
In a flexed state, the muscles are not strong enough. That is called like low tone. Okay. And the second thing is again observing the child's developmental milestones. The child has to roll over and sit properly without support, creep properly and crawl properly.
And what age is this one?
This is like rolling over comes around 4 to 5, 6 months, in between 4 to 6 months. That head control comes around again 3 to 4 months.
Head control.
Yeah, the child has to be on his prone, that means the child has to be on his tummy, so that the child can lift this head alone, body alone, neck alone. So those are all the milestones. If there is any delay in achieving these things, or even if you see some children or they don't crawl, many parents say that my child did not crawl, he just started walking. That is actually, it's not a good sign. The child has to crawl for a particular period of time to avoid later complications.
Okay.
So when the child crawls well, what happens? He will get all the adequate muscle strength, the postural control, strength and everything, and even the neck muscles become more strong. And while crawling, looking up, like far vision and near vision, the shifting of visual gaze, that will also improve. So those are the minute things that the parents has to know about that.
Okay.
Yeah.
So from this I understand that the movements of the child, especially in the infant time, that is
Exactly.
the age less than 1 year, is very important.
Yes.
Why it's you are telling so? Why it's crucial?
Actually 0 to 12-month period is very, very crucial, because that is the foundation for later development of the brain. So we call it as like developmental stage, or we call it as like building blocks for the later development. If any skills or any milestones are skipped, or any milestones achieved in the inadequate period, then it will definitely have consequences in the later stage. So that is why the child has to roll, the child has to be on the floor for some time. Nowadays, most of the parents are taking more care about their infants, always pampering too much, and always carrying them or putting them in a stroller. They are not letting them to be on the floor.
So we should let them to be on the floor,
Exactly.
to crawl and to move. This is very important.
When the infant is on the floor, you will have more opportunity to explore things. If there is any toys, or you will try to look at the toy, so you will try to reach out the toy. So then that way eye and hand coordination will develop. You will attract. It is all like it will improve the cognitive function and also the social function also. The child has to look at your eyes, and the child has to respond to any noise, or at least for a name call. He has to give a response to that, and the child has to smile at you whenever you make some kind of funny actions. So those are all the indications that child is developing normally. Okay. If anything is missed, if any those skills are not achieved, then we can say that this child will have some kind of problem.
Okay, so I know that you are mainly dealing with the pediatric, that is, you are a pediatric occupational therapist. So can you just list down some of the major complaints that you are getting from the parents about their kids? Like, what kind of kids are approaching you?
Before, there were a lot of developmental disorders, like neurological disorders like cerebral palsy and Down syndrome. Those are the things. But nowadays,
congenital, by birth itself,
ones. Yes, but now those congenital cases are becoming less. Instead of that, we are getting more acquired conditions. Like, everything, the child born normally, everything went normal, but at a particular age, the child started showing some kind of, regression in their development. So that is mainly because of the environmental factors and lack of movement.
Okay.
Like
so
nowadays,
what is the complaints they are telling verbally? Like, my
child is not speaking. That is a major complaint first. And if we ask why, what is the reason for not speaking, means what is the routine of the child, means they say that my child is sitting in front of the TV for a long time. So prolonged screen time is also one of the reason for regression in development.
Okay, that's also a reason for the speech delay. That is also a reason for...
Like what happens when the child is sitting in front of the TV for a prolonged period of time, there is only opportunity to receive like kind of receptive language. There is no opportunity for expressive language. The child just sit and watches, just listens, that's it. The child is not talking back. There is no opportunity for expression. So that is the reason most of the child is having kind of speech delay nowadays.
Okay.
Yeah.
Actually, I don't want to lengthen my video. So some crucial part we have discussed. So rest of the part, that is about the basic therapies, what they are doing, and also what is the advice to the parents to avoid these issues, and what are the guidance that parents to be done at home, will be shown in the next part. Thank you so much for watching. Bye bye.